This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Lila Carter.
Welcome to the Good Neighbor Podcast. Are you in need of a chiropractic healthcare office? One might be closer than you think. Today, I have the pleasure of introducing your good neighbor, Bobby Moore with Pittsburgh Spine and Injury Center. Bobby, how's it going?
Good, Lila. Thank you for having me.
Thanks for being here. We're excited to learn all about you and your business. So please tell us more about your organization.
So I've had a Pittsburgh Spine and Injury Center for almost 3 years now. I've been in practice for almost 15 years. As an associate and then an independent contractor. And I got to the point where I felt like I could do a better job on my own. And so I took the leap and opened up my own office about almost 3 years ago. And it's been great. Definitely some uphill battles with running a business for the first time, being the first business owner in my family. And then, dealing with the headaches that insurance companies can sometimes bring has been great. But it's also given me a great opportunity to go from a very stressful, high volume practice where I was previously at to more of a one-on-one approach. I find that my patients get much better outcomes and less appointments, and that's great for everyone.
How did you get into this business initially?
That's a great question. I initially, even as young as I was, I think 11 or 12 years old, I've always been into health and fitness and kind of being the best human that I could possibly be. And I knew from a young age I wanted to help people achieve that. So I remember even at 12 years old, my brother and I saved up our money and we bought a weight bench from Dick's Sporting Goods. And ever since then, again, it just stoked the fire of wanting to help people in a natural way. I'm not against medicine or anything. I actually initially was going to go to pharmacy school. And then once I shadowed a pharmacist, I discovered it wasn't for me. I think it's a very awesome career field. We need pharmacists, so I have nothing bad to say about them. But I wanted to help people without the use of drugs or surgery. While drugs or surgery do have their time and place, at me personally, and I feel from a professional standpoint, if we can avoid anything like that, usually the outcomes are better. And there actually is recent research to prove that.
Sure. And what are some myths or misconceptions in your industry?
I could talk all day about this. I think chiropractors, there is a broad spectrum that they're allowed to practice, and their scope of practice allows them, thankfully, to do that. However, there are a lot of chiropractors out there that tend to be on the more holistic side, where currently, especially with social media and the onslaught of information that we get on a daily basis, that is sometimes good and most times BS, if you ask me, even from a holistic and a medicine standpoint. But a big misconception I find is that we're quacks, right? We're not real doctors, which is fine. I always tell my patients, I don't care what you call me. You can call me doctor, you can call me Bobby. I just want to help you feel better and move better and live better. And I'm pretty good at that. I've got great success rate with that. And if I don't, I pride myself in being able to get the person at least to where they need to be, whether it's someone up the food chain, like a pain specialist, physical therapist, orthopedic surgeon, something like that. And that's kind of been my focus on my practice and how I treat patients. Number one, I see, is this even something that I can help with? So my first step when I see a patient is to diagnose what the actual problem is. Not just, well, let's adjust your spine, make it crack and pop a bunch and hope you feel better. But I really want to find out what's causing your pain. Why is that pain there? And what steps can we take to fix the problem that's causing the pain? And then I've been finding the last 3 years since opening my practice has been great success with that.
Yeah, it's certainly a more holistic approach there. Now, as we know that marketing is the heart of every business, who are your target customers and how do you attract them?
My target customer is anyone with a spine or really any joint. So that's a pretty broad scope. I will say my specialty in the last 10, 15 years has been more auto accidents and more acute trauma. However, I definitely have a lot of experience with chronic issues as well. One thing that I employ in my office is not only just the chiropractic adjustment, but also working on the soft tissues in that area. A lot of times what I see happen in problems that have been around for greater than a year is we get a lot of motor patterns or muscular compensation. So we get some motor patterns that aren't quite the most optimal, but your body's been guarding and protecting that joint. So we have to pull that aside, get that joint moving properly. One modality that I really like to use and employ in my office is called a shockwave device. And that's a medical device that delivers a little bit of acoustic sound wave into the tissue, which helps release any muscular adhesions, scar tissue buildup. Number one priority is always to get that joint moving pain-free, and then we can stabilize it. And then a lot of times I don't have to see the person ever again.
Very cool. So yeah, that's funny that you said anyone with the spine. So everyone with the backbone, go see Bobby. If you're an alpha male, you can see Bobby.
Well, I will say there have definitely been patients, and obviously I don't want to say say that kind of tongue in cheek. There's obviously people I see where I say, hey, you might have some sort of nerve compression or some sort of previous surgery, or even a congenital anomaly. There's some pretty rare congenital anomalies that have kind of come across in my career where if I hadn't discovered that with the use of an X-ray or a proper examination, adjusting the person or treating the person could have been very detrimental to their health and well-being. So I think that's one of the things I pride on as myself as well, is make sure it's safe to adjust you and treat you, and then figure out where we need to adjust and to treat you.
Yeah, that's great insight. Have you ever thought about doing your own podcast? I mean, there's so much to learn about this subject matter.
Yeah, I thought about it. I've been on a couple podcasts. My time is just very limited, unfortunately. I'd be open to it. I also, in addition to running my office, I also coach fitness classes at a CrossFit gym in Millvale, Pennsylvania, right outside of Pittsburgh. And then I teach at Point Park. I teach anatomy and physiology at Point Park as well, university. So that keeps me pretty busy.
Yeah, you sound like a busy guy. So outside of work, what do you do for fun?
Well, I have 2 young kids. So that takes up the vast majority of my time. I'm big in the outdoors and weightlifting. So we like to go on hikes, we like to ride our bikes. Just past weekend, we were up at North Park enjoying the scenery up there and some of the trails. I also like to go down to the Heritage Walk, on the River Heritage Walk from Millvale down to the Point. It took me a minute to be okay with it, but I'll admit I like to go rollerblading down there. So if you see this big chiropractic bald-headed beard guy on roller skates zooming down there, that's me.
That's great. Yeah, rollerblading seems probably more attainable for me than like roller skating, I guess. Like the movements are more similar to skiing, so I'd probably have a better time. Yeah. So Bobby, please tell our listeners one thing that they should remember about Pittsburgh Spine and Injury Center.
One thing you should remember about it. I like to tell when I'm teaching my anatomy class, or when I'm coaching a fitness class, or even when I'm one-on-one with a patient, if you can keep your spine mobile, or even any joint as mobile, and the key word is pain-free as possible, and then just stay active. My mom told me a quote years ago that I use almost on a daily basis, and she said, "Bobby, you got to keep moving or they'll throw dirt on you." And I think it's they're very adept, because I see it happen over and over again, where we'll get someone coming out of college and high school. Maybe they played a sport in high school. They were in really good shape. They felt good. And then they entered the workforce. So they went from being very active, stressing their joints, stressing their body, stressing their muscles on a regular basis, to unfortunately just more sedentary lifestyle because of their career. And there's nothing wrong with that. We just want to make sure we're utilizing our joints and our muscles. And so use it or lose it type instance. If you stop bending over to reach out and pick something up, your body's not going to be used to doing that. So those muscles and ligaments and tendons and joints are going to degrade over time, because you're not stressing your body that. So my biggest recommendation is keep moving. If you find something that is painful when you move, don't lean into the pain. Find a specialist like myself, or any great chiropractic or physical therapist, or any doctor for that matter, that can help you treat the underlying issue.
And how can our listeners learn more about Pittsburgh Spine and Injury Center?
So we have a website. You can book online directly through our website. I have kind of a small office where it's just me, myself, and I, and sometimes I have my wife to help out with the front office and answering phone calls. But what's a good thing about it, and what I like most about my office, is I get a lot of one-on-one time with the patient. So you get that custom sort of tailored experience where it's not just, well, you have back pain, do these stretches and these exercises and come back in a week. Like I said before, not to sound like a broken record, but we're going to find the actual problem and then determine if it's something that we can manage conservatively or if we need to get you out to someone else. Now, I have a website, like I said, you can book online. I have a lot of my patients, they book their appointments through that, whether it's their first appointment or follow-up visits. I also have all the social medias. We have a Facebook, we have an Instagram, a YouTube, and even a TikTok. I try to be a little more proactive about getting media and content pushed out on there with the busyness and hectic of running a business and having a young family. It doesn't happen very often, but it's something that's coming down the pipeline.
Very good. Well, Bobby, I really appreciate your time today and having you as a guest on the show. We wish you and your business the best moving forward.
Thank you so much. This was great. I appreciate your time. Thank you for having me.
Thanks for being here.
Thank you for listening to the Good Neighbor Podcast. To nominate your favorite local businesses to be featured on the show, go to gnppittsburgh.com. That's gnppittsburgh.com or call 412-561-9956.